Hi there. I am recording this video series on acute and chronic pancreatitis and pancreatic cancer. There are some guidelines that I will have posted for you to review, preferably before you start into these video series. Let's take a look at your pancreas and remember that it has both endocrine and exocrine functions. The endocrine portion, we addressed that when we talked about diabetes. That part of pancreatic function is via the islets of Langerhans. You can see those, and what you need to understand is that they secrete, what word you want to use there, their hormones into the bloodstream. That would be insulin, things like that. And then the exocrine portion of the pancreas releases its substances into the pancreatic duct, things like sodium bicarbonate solution and various digestive enzymes. Those secretions are then dumped into the duodenum at appropriate times. So that's your basic pancreas. All right, acute pancreatitis. This is an acute inflammatory process of the pancreas, and the degree of inflammation varies from just a mild edema to severe necrosis. So how sick the person gets is going to depend. It affects middle-aged people. There are 80,000 new cases every year, and of those 80,000, 20% will be classified as a severe pancreatitis. Severe ends up being life-threatening, requires ICU. It may cause acute respiratory distress syndrome. It can cause acute kidney failure, cardiac depression, hemorrhage, hypotensive shock. Mortality, if the person has a severe form of pancreatitis, the mortality is 20%. So 20% of pancreatitis falls into the severe category, and of those people, 1 in 5 will die. So, the primary etiologic factors are alcoholism and biliary tract disease. This is one of the reasons why we don't mess around with gallstones and gallbladder issues, because that patient who has gallbladder issues may very well develop pancreatitis. These two factors account for 85% of the cases. Women are 1.5 times more likely than men to get their pancreatitis from gallstones. On the other hand, men are 6 times more likely than women to have acute pancreatitis caused by alcoholism. Of people who consume a lot of alcohol, 10 to 15% of them will develop acute pancreatitis. So it's very common among alcohol ingesters. Well, let's just call it that, right? Etiology. Some more causes that would be, beyond the 85%. So the other 15%, trauma, like post-surgical trauma or abdominal trauma, can injure the pancreas and produce pancreatitis. People who have elevated triglycerides can develop a pancreatitis because the triglycerides can injure the pancreas. Viral infections, a penetrating duodenal ulcer. If you think about your anatomy again, the pancreas butts right up into the duodenum. I kind of picture it there. The duodenum's kind of coming around it. So if there's a duodenal ulcer that perforates, it would irritate the pancreas. Some other reasons could be abscesses, cysts, and tumors, cystic fibrosis, Kaposi sarcoma, which is part of the HIV, and then lupus can cause acute pancreatitis. There are some medications. Your Lewis book identifies some of those. Drug-induced acute pancreatitis is rare, so less than 2%, but it should not be overlooked in cases of idiopathic acute pancreatitis. We had a gentleman on the 8th floor who developed acute pancreatitis secondary to one of the anti-diabetic medications. I'm not sure I can remember right now which one it was. One of the newer ones. Some other drugs that are implicated would be mesalamine. You should know that drug. It's an anti-inflammatory drug used to treat ulcerative colitis. The highly active antiretroviral therapy. Patients with HIV are anywhere from 35 to 800 times more likely to develop acute pancreatitis because of these medications. Statins have been implicated. Valproic acid, especially in children, can account for that. Loop and thiazide diuretics, not often. I've never been aware of a patient who has developed acute pancreatitis because of Lasix or hydrochlorothiazide. But obviously, I mean, it's in the literature, so it must happen. So what happens? We're still looking at causes. We're still looking at that 15% bracket that isn't gallstones and alcohol. So some metabolic disorders, hyperparathyroidism, the calcium can lodge in the pancreas and cause irritation, inflammation, as can hyperlipidemia, particularly the triglycerides. Acute pancreatitis can also be iatrogenic, where it happens after an ERCP, where they go down into the area trying to retrieve a stone, and in the process of doing that, there's reflux, maybe reflux of bile into the pancreas, or injury that produces pancreatic inflammation. In some cases, we just don't know what the cause is. So now pathophysiology. Autodigestion is thought to be the most common pathogenic mechanism. What happens is that pancreatic enzyme activation happens in the pancreas rather than in the intestine. What's supposed to happen is the pancreatic enzymes are dropped into the duodenum and they are activated there, and that's where they work. Well, if they are activated in the pancreas, then the enzymes do begin their digestive processes in the pancreas. How and why this happens is not clear. Maybe it's related to reflux of bile into the pancreatic duct. Just not clear. The range of injury is going to be from mild and self-limiting, which is, kind of edema, to a necrotic situation. In your necrotizing pancreatitis, the degree of necrosis is going to correlate with the severity of manifestations. If you look at this picture here, this is referring to a hemorrhagic area. Necrotizing pancreatitis actually involves death of the pancreas tissue, and it can lead to these cyst-like pockets and abscesses because of the location of the pancreas, which is retroperitoneal. You guys know that. The inflammation can spread pretty easily. In a very severe case, the fluid containing toxins and enzymes will leak from the pancreas through the lining of the abdomen, which can damage blood vessels, cause internal bleeding, and be very life-threatening. So here you have an inflamed pancreas. You see a lot of edema, but you also see hemorrhagic portions with it. Okay, I'm going to stop here, and I'll be back.